Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about hypercalcemia. So, you all know that total calcium ranges from 8.5 to 10.5 milligram per deciliter. That is from 2.12 to 2.62 millimoles per liter. And ionized calcium ranges from 4.65 to 5.25 milligram per deciliter, that is 1.16 to 1.31 millimoles per liter. So whenever the level of calcium is more than its normal, that is when the total calcium is more than 10.5 milligram per deciliter and the ionized calcium is more than 6 milligram per deciliter, we call it as hypercalcemia. So it is 10.5 and more than 5.25. So we can divide hypercalcemia as mild, moderate and severe. Mild is when the level increases from 10.5 to 11.5. Slightly there is an increase above the normal range. Moderate is when the level increases to 12 to 13.9. And severe is when the level of serum calcium is more than 14 milligram per deciliter. And hypercalcemic crisis is when the level of calcium goes beyond 14 to 16 milligram per deciliter, that is called as hypercalcemic crisis. Calcium is an essential mineral which is tightly regulated by few of the hormones in the body. This becomes important for us to understand what can cause hypercalcemia. So you know that parathormone, the calcitonin and the vitamin D all help in regulating the calcium, that is the ionized calcium. So calcitonin, which is produced by the thyroid gland, what is its role? It will reduce the level of calcium in the blood. It will inhibit the absorption of calcium from the intestine. It will promote the deposition of the calcium in the bone, and it also inhibits the reabsorption of calcium from the kidney. So the level of calcium in the serum is going to reduce. Whereas PTH, which is produced by the parathormone, it increases the level of calcium in the blood. So, disorders of parathormone are going to cause increased calcium in the serum. So, parathormone, what it will do? It will stimulate the osteoclastic activity. It will resorb the bone. It will increase the level of calcium in the bone. It will increase the absorption of calcium from the intestine. It will also increase the reabsorption of calcium from the kidneys. So whenever the calcium level is increased, the thyroid gland releases calcitonin and it will osteoclastic activity is inhibited, calcium reabsorption takes place and calcium level decreases. Whenever there is decreased calcium level, the PTH comes into play, osteoclasts are activated, calcium is reabsorbed from the urine and calcium reabsorption also happens in the small intestine and there is rise in the calcium level in the blood. So, now coming to the causes of hypercalcemia, we can divide the causes as parathormone dependent and parathormone independent. There are various causes: malignancy associated, granulomatous disorders associated, drugs which are associated with hypercalcemia, and there are other miscellaneous causes. So let us see each causes one by one. So parathormone dependent hypercalcemia, that means there is some issue with the parathormone. So it could be primary hyperparathyroidism. So in primary hyperparathyroidism, what happens? There is primarily a problem with the parathyroid gland. So usually in 80% of the cases there would be a parathyroid adenoma which is secreting more and more of parathormone, and if the parathormone level increases, calcium level in the blood increases and that causes too much of calcium in the serum. Similarly, you have tertiary hyperparathyroidism. What is tertiary hyperparathyroidism? It is nothing but a parathyroid hyperplasia which happens because of chronic overstimulation, usually in patients who have this kidney failure, kidney transplant, etc. So in such cases, there is constant overstimulation of this parathyroid gland. So it is constantly under pressure to release more and more of PTH. So that is called as tertiary hyperparathyroidism. Then there is something called as familial hypocalciuric hypercalcemia. So here this is a genetic disease which is occurring because of loss of functional mutation in the calcium sensing receptors. So here what happens, the patient has increased calcium level in his blood. There is decreased calcium excretion in his urine, and this happens because of the mutation in this calcium sensing receptor gene. Multiple endocrine neoplasia. So here when you have pituitary adenomas, parathyroid hyperplasia, pancreatic tumors, etc., they can lead to hypercalcemia. Then there are few conditions which are parathormone independent. For example, you have malignancy related hypercalcemia. So certain cancers like multiple myeloma, or there is breast cancer, certain renal cancer, head and neck cancer, gynecological cancers, what happens is the patient will have hypercalcemia, the cancer associated hypercalcemia. So now why this happens? Because these solid tumors will produce something called as parathormone related protein. So they will cause release this parathormone related protein. So what this will do, it will help in the increase reabsorption of the calcium from the kidney. It will help in the osteoclastic activity. It will help in the increased intestinal absorption of calcium, and the calcium will rise. So it is mostly related to the secretion of this parathormone related protein. So you can see here that this is a tumor cell, this is a cancer cell, could be a breast cancer, could be a renal cancer, etc. It stimulates the parathormone related protein expression. So whenever this parathormone related protein expression is there, there is resorption of the bone by this osteoclast. It will stimulate this kidney to absorb more and more of calcium, and there is increased level of calcium. Some other factors also can increase the level of serum calcium, like calcium intoxication. Increased calcium in the diet sometimes can cause, there is increased level of calcium in the serum. There are few endocrinopathies. For example, hyperthyroidism. So whenever the level of thyroid increases, what happens is there is increased bone resorption and osteoclastic activity, which will cause increased calcium. Pheochromocytoma. Pheochromocytoma is a tumor when there is increased level of catecholamines. Along with catecholamines, there is something which is related to the parathormone, that is the parathormone related peptide, that is also secreted. So it has an action similar to parathormone. So that is again going to rise the calcium. In adrenal insufficiency, so whenever there is insufficiency of adrenal gland, it will reduce the glomerular filtration rate, the mobilization of calcium from the skeleton. It will lead to hypercalcemia. Acromegaly, when there is increased secretion of this growth hormone, it can activate the vitamin D and cause hypercalcemia. Certain granulomas, those associated with tuberculosis, sarcoidosis, certain fungal infections, etc. Whenever we see a granuloma which consists of these epithelioid cells, giant cells, etc., sometimes patient has hypercalcemia. So you can see some of the sarcoidosis patient, they complain of hypercalcemia. That is because in this granulomas there is 1-alpha hydroxylase enzymes which is present in the macrophages. So granuloma mainly consists of these macrophages. So when this macrophages, this giant cell contains this enzyme 1-alpha hydroxylase, and also in this granuloma 25 hydroxyvitamin D is converted to 125 dihydroxyvitamin D without any control. So that will lead to increased calcium level. These are the various other causes of hypercalcemia. So I've told you malignancy associated hypercalcemia. There is parathormone mediated hypercalcemia, primary, tertiary parathyroid carcinoma, familial hypocalciuric calcemia, granulomatous disorder, sarcoidosis, tuberculosis, leprosy, candida, histoplasma, Crohn's disease, etc. Drugs like thiazides, lithium, vitamin D, vitamin A, they can lead to hypercalcemia. And I've told you certain other endocrine disorders like thyrotoxicosis, adrenal insufficiency, pheochromocytoma, parenteral nutrition, renal failure, immobilization. All this can lead to increased calcium level in the blood. So whenever the calcium level increases more than the normal, that is when we call it as hypercalcemia. So this calcium will be more either because of some problem with the parathyroid gland, there is a parathyroid adenoma or parathyroid hyperplasia, primary or tertiary hyperparathyroidism. There is some kidney issues because of which the level of calcium will rise, like in case of familial hypocalciuric hypercalcemia or thiazides, the diuretics, which can rise the calcium. There will be granulomatous diseases like TB, etc., wherein you will see that they will activate the 125 vitamin D, and that will lead to increased calcium absorption and increased calcium level. And also immobilization. Whenever there is immobilization, there is increased resorption of the bone. Malignant tumors because they secrete something related to the parathormone. Hyperthyroidism, acromegaly, adrenal insufficiency, all this can lead to hypercalcemia. So these were few of the causes of hypercalcemia. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.